going to go over some questions about your sexual health. What about problems with your libido?
It's not what it was in my 20s or 30s, but it's there.
Hello, how are you today?
I'm doing okay.
All right, my name's Abby. I'm going to be your nurse today, and we're going to go over some questions about your sexual health. Is that okay?
Yes, that's fine.
All right, to get started, can I get your full name and your date of birth?
My name's Judy Smith. My birthday's February 31st, 1950.
All right, great. And Judy Smith, what do you like to be called? Judy, Miss Judy, Mrs. Smith?
Oh, you can call me Judy or Mrs. Smith, whichever you want.
All right, thanks, Mrs. Smith. And do you remember when your last menstrual period was?
Yes, I was 45 when I had a hysterectomy.
All right, great. And what was your period like before your hysterectomy?
It was fairly regular, a little bit heavier. I had the hysterectomy because of some prolapse, and my period was a little heavier, and I was done with my uterus.
And what about right now? Do you have any problems with night sweats or dryness or pain when you pee?
I had a lot of hot flashes and night sweats in my 50s, but I don't really have too much problems with that now. I have a lot of dryness, but I found some things that help with that.
All right, very good. And what about problems with your libido?
Well, it's not what it was in my 20s or 30s, but it's there.
Okay. And do you remember when you had your first period?
I was 13.
Okay. And right now, are you widowed or married, or do you have a boyfriend?
Oh, yes, I just got remarried 3 years ago, believe it or not. I was widowed when I was 68. But I met a nice man at the independent living facility, and we're celebrating 3 years next month.
Oh, congratulations. Congratulations. And how are you guys feeling about your intimate life? Are you comfortable with it? Are you having problems with it?
Well, I don't want to share too many details, but I will say we're satisfied.
Okay. And is there anything that you think the doctor could help with that?
No, I found me a lubricant that helps with the dryness, and it works really well. And we're older, but we found what works for us.
All right. Well, I think that's great. What about pregnancies? Have you had any pregnancies?
Yes, 5 births. I've got 5 children, and I've got a lot of grandchildren and 2 great-grandchildren.
Oh, congratulations. And all 5 births, were they to term?
Oh yes, they were all on time or a little late. Big babies.
Okay. And did you have any other pregnancies that ended earlier?
No, just those 5. I'm very blessed.
Okay. And do you remember the date of your last pap smear?
I don't remember.
That's okay. And then let's see. We usually go over with people the prevention of sexually transmitted infections and hepatitis and HPV. Are you in a monogamous relationship with just you and your husband?
Yes, honey, it's just the 2 of us.
Well, that's great because that greatly diminishes your chances of having any problems with that. So that is wonderful. And we go over contraceptive measures with our younger patients, but I think you got your grandchildren. I don't think any more babies are on their way. All right. How about vaginal discharge? Do you have any problems with that?
No, no problems.
Do you have any lesions or pain or swelling in your private areas?
No, no problems with that. It does get itchy sometimes.
Okay, tell me about the itching. Is there any particular thing that causes it, you think, or that makes it better or worse?
Uh, it's worse at night, but maybe just because that's when I'm thinking of it. I don't think it's a yeast infection because I had those when I was younger. I don't think it's a yeast infection.
Okay, we'll let the doctor know. There might be a cream or something he can give you that would help with it. He can take a look and see if there's maybe some things that might be able to help with that.
That would be good.
And do you have any problems with pain during sex?
Well, we use lubricant. We don't do it the traditional way a lot. But it's fine. It's fine. We found what works for us.
That sounds good. That's very, very healthy that you've gotten creative maybe with ways to enjoy each other. And that's very normal and healthy. So I'm glad to hear that. Do you know when you had menopause?
Well, my hysterectomy was at 45, and I know I had a lot of hot flashes and night sweats through my 50s.
Oh, that's right. You said you had a hysterectomy at 45. And what was the details of that surgery again? What caused you to get a hysterectomy?
After my fourth child was born, I had some uterine prolapse, they said. And after my fifth child was born, I had some uterine and bladder prolapse. And I was having a lot of problems with that and some dribbling. And so I had a hysterectomy and they tacked up my bladder and they put some mesh in there to hold things in place. And it's a lot better. That really was not good right before that surgery, but it's doing a lot better. And I have some problems, because of my age, I think, with a little bit of dribbling now, but it's not really something that bothers me, the amount. It's not too bad.
Okay. Well, that goes right into our next questions. When you feel like you need to go, is it like you can't get to the bathroom quick enough, or is it like you cough and you go a little bit when you cough?
It's a little bit of both, but just a little. I don't want another surgery or anything. It's just a little. I'll use a poise pad if I'm going out for like a long day trip. I'll feel more confident and comfortable, but usually really it's not much of a problem.
That's great. That is great. Do you have any history of gynecological cancers?
Nope, none in my family.
Okay, and you said you had your hysterectomy. Do you know if they removed your ovaries or your cervix, your uterus?
I think I kept my cervix and my ovaries. So and like I said, I was in my 50s when I first started getting those hot flashes. I don't remember when.
All right, that is very helpful. And do you have any history of sexually transmitted infections you were treated for in the past?
No, no.
All right, thank you. And now we're going to talk about your breast health a little bit. Do you have any lumps or thickening in the breast or axilla areas, like under your armpits?
I have, I mean, they're not as dense as they were when I was younger, but I've always had thick, dense breasts.
Okay. And that makes it a little harder sometimes when they do mammograms. What about nipple discharge or any changes in the appearance of your nipples?
No,
And any skin color changes or like dimpling or discoloration or new, just anything that looks different, swelling.
no, nope. They look the same, just a little saggier.
Okay. And do you have a history of fibrocystic breasts?
Yes, I had a fibrocystic lump removed, but it wasn't cancer, and I don't have any family history of cancers in the breast. It just I have very dense breasts.
And that's common sometimes to need those lumps removed if they get painful. Let's see. Let's go over risk factors for cancer. You said you don't have any family history of breast cancer,
No, not in my family. What a blessing.
and you were 13 when you got your first period, so that's good because a risk factor is starting before age 12. How old were you when you had your children?
Oh, 21, 23, 26, 28, and 30. Boom, 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 boom.
Oh, wow. I bet you had your hands full for a while.
Oh, when they were little, it was crazy. But now that they're older, and even when they got to be older kids, it was fun to watch them grow up together. I'm glad I had them close in age.
Oh, that sounds great. That sounds great. And how about mammograms?
Oh, honey, I think I had one 3 years ago. So, uh, I'm not too worried about it without a family history of it, and I've got this old, but I think 3 years ago I had one.
All right. Well, we can let the doctor know and he can go over your risk factors and advise you about when that's needed, if that's still needed. Is there anything else you can think of that we need to discuss?
Nope, nope, thank you so much.
All right. Well, thank you. And I'm going to put this stuff in your chart. And when you meet with the doctor, they'll go over all that. And also, hopefully, he can figure out maybe what's causing some of the itching that you're having at night and figure out a way that we can treat that and make you get into feeling better. So it was good to meet with you, Miss Judy.
Thank you so much. You too, sweetie. Bye bye.
Bye bye. Have a good day.